Excellent. Thank you very much. Hi, everybody, and welcome to my Birds and the BBB Bites presentation on hepatitis C testing and treatment. I'll just share my screen with you all and start the presentation. So I'm from Hepatitis WA, and before I start, I would like to acknowledge the traditional custodians of these lands, especially the Pinjarab Noongar people from the area where I am today in Mandurah, and I'd like to acknowledge elders both past, present and future. So the World Health Organization, the WHO, has a target to eliminate hepatitis C as a global health concern by 2030. There are 11 countries who are currently on track to do that, and Australia is one of them. So it's not a race, but we could be winning. This is a little map of the world. The darker colour countries have a higher prevalence of Hep C and the lighter colour countries have lower. So Australia's the tan colour, so we have a low moderate. So that's between a 0.8 and a 3.1% of our population are living with hepatitis C, and the darker countries, that goes from about a 3% to a 7% of their population are living with hepatitis C. So in line with that target, the Australian government put on the PBS in March 2016 direct-acting antivirals. These are tablets. You either take from 1 to 3 a day. There's a 95% cure rate. Average of taking them is a 12-week period, and there are minimal side effects, so really hardly any side effects at all, which is excellent in comparison to the old treatments. This is what hepatitis C looks like in Australia. So hepatitis C, first off, is a blood-borne virus, so it's from blood-to-blood transmission. And each year about 630 Australians die from hepatitis C related causes. The good news is we've had so far 90,000 Australians who've been treated with the new treatments and cured of hepatitis C. The challenge now is to find the approximately 120,000 remaining people who will benefit from treatment. Just to show you treatment uptake. So from 1997, when the first treatments were developed for hepatitis C, they were interferon-based treatments. They weren't well tolerated. They had quite severe side effects, and the success rate was around 60%. So you see there was a very low but steady uptake over the years. In 2014, the new direct-acting antivirals were first licensed and people were able to have access to them, but it was still limited access. And you can see then 2016 shot right up because all the people who'd been waiting for these treatments to go onto the PBS were finally able to access them. Since the 2016 period where a lot of people took on the treatments, the numbers of people receiving treatments annually has been sliding. So this is a quarterly reporting period in each of these bars on the table, on the graph. So how do you know whether you have hepatitis C? So the only way to know is through a blood test. I've included some of the symptoms up here. These symptoms aren't experienced by all people, and it takes about 15 to 20 years to experience symptoms after the infection. And they can be quite mild symptoms, and they're quite random symptoms. I can just hear somebody in the background. If you're able to put yourself on mute, that'd be great. Thank you. So yeah, the symptoms, you might not necessarily think of hepatitis C as the first option if a person is presenting or you yourself have these symptoms. So blood testing is the only way to find out. Hepatitis C blood testing may be included as part of a 715 annual screening or may not, so you can check with your clinic, and it could also be included as part of an STI screening. And we'll go through what blood tests should be included to check for hepatitis C as well. But before I do that, I just want to show you this video because it really explains well all about hepatitis C symptoms, testing and treatment. And I wanted to include it because it's a perfect resource to show people who you might be working with, patients or clients who may have hepatitis C. So this link will be available for you as well.
You've had a blood test called a hepatitis C antibody test, and the test has come back positive. This means the test found hepatitis C antibodies in your blood. At some point, you've come in contact with the hepatitis C virus. Hepatitis C is a virus that lives in the blood and can have serious effects on your liver, even causing cancer. Around 1/4 of people clear the hepatitis C virus on their own. Unfortunately, even if they do fight it off naturally, they can get it again if they put themselves at risk. There is no immunity to hepatitis C and no guarantee of being able to clear it a second time. Your doctor or health worker will have to do another test to see if you have the hepatitis C virus. This is called a PCR RNA test. If this test is positive, it means that you have the hepatitis C virus, and without treatment, it will be there for life. They will also discuss with you about when you think you may have contracted the virus.
So what will happen to me?
Most people living with hepatitis C don't feel sick for a long time, but slowly, over many years, they may get tired, run down, and unwell. This can make life a lot harder to live, and sometimes is very serious, even deadly. The good news is there's now a very effective cure that you can get from your doctor. There are new treatments to cure hepatitis C, and around 95% of people on treatment will be cured. Just be aware, even if you clear it or it's cured, you can still catch it again.
What is the treatment?
For most people, all it takes is 1 pill a day for 8 to 12 weeks and a few simple blood tests along the way. It's very important that you take your treatment every day until you complete the course. Unlike previous treatments, there are very few side effects. During treatment, your doctor or healthcare worker will do a blood test to see how you're going and if it seems to be working. After 8 to 12 weeks, you'll have finished your medication, and you'll have another test which we hope will confirm your hepatitis C is gone. The doctor will want to see you again a few months after taking your last tablet. There will be another test called an SVR test. This is the most important blood test, as this is the one that tells us if you're cured. But remember, this is a cure, not a vaccination, so you can get hepatitis C again if you put yourself at risk. If you become reinfected, that does not exclude you from further treatment.
How do you get hepatitis C?
Hepatitis C is only passed on through blood-to-blood contact. Most everyday activities do not pass blood from one person to another. Just living, working, and being around people who have it is not a risk. The most common way of passing on blood is by sharing any equipment used for injecting drugs. And you can get it from using unsterilized tattoo and body piercing equipment, or sharing razors and toothbrushes and ceremonial tools. So basically, anything that passes infected blood from one person into another.
How do I stay healthy?
To make sure that you're cured, you must take the pills every day for the time your doctor says and have your blood tested when it's needed. Stay in contact with your doctor or healthcare worker. They're here to help you follow the treatment and answer any questions. Don't share anything that can pass infected blood from one person to another. And we all feel better when we eat well, exercise, and cut down on the grog. Your liver will thank you for it. You can always call the people at Hepatitis WA on these numbers. And remember, there's always care and support for you when you need it.
Okay, so that link will be available for you if you would like to use it. Actually, I think this whole PowerPoint might be emailed through to everybody by Veronica, because there's quite a few links in here that might be helpful for people going forward. So who's eligible to prescribe? So all medical practitioners, so GPs, and also nurse practitioners can prescribe the treatments for hepatitis C. Those who don't have experience with prescribing can do what's called a remote consultation form. Now, that is not a referral, but it's a form that you fill out and you would fax through to your hospital, and a gastroenterologist or other health specialists will have a look over it and see whether they agree or not with your treatment plan. So I'll just show you what that looks like. So if you put your hospital's information up here, your details, you're the referring practitioner, patient details, date of their hepatitis C diagnosis and whether they have known cirrhosis, any other conditions that they may have, if they've had prior treatment, medications that they might currently be on, and whether you've checked for potential drug-to-drug interactions with the current medications. So if you click on this link, I won't now just because of time, but that will take you to the Liverpool drug interaction website where you can put your patient's medications, what they're currently on, and what medications you're planning to prescribe, just to make sure that that's all okay. You would fill in all this area of your patient's blood test requests or attach copies, blood test results, I should say. And then here, whether you have assessed for fibrosis. So you can even do a fibroscan, which is also known as an elastography. Sorry, I get my tongue around that word. Currently, you can get an elastography done in Perth through SKG, not through every SKG. Only certain ones have the availability of this scan. But they bulk bill this scan. If you don't have it, if you have a Medicare, if you don't have a Medicare, the cost is $320. Unfortunately, they don't have any other regional SKGs who do it besides Bunbury. I just checked with them last week. But wherever you are in your particular town, you can find out whether you have access to these scans or not. Another test to do is also an APRI score, and that I'll just take you here. If you click on this little link, what you need to put in to find out what an APRI score is you need to put in your patient's blood test result for the AST, which is part of a liver function test, but it's usually a test that you need to add on to a liver function test, and also their platelet counts. And this will automatically calculate it and give you a APRI score for your patient, which will indicate liver stiffness. So you can see the guidelines there underneath. Then you would mark which medication you are planning to give and how long the treatment is going to last for. Send it through and you will hear back from the specialist to say whether they agree with your treatment plan or whether they suggest that you do something a little bit different. Let me just close that. The other thing you can do when you just going back a bit, so if you send that through to the hospital, it could take a week for them to get back to you, or maybe a little bit longer depending on how busy they are. So your other option is the ASHM website. They have the REACH-C study going, and you can fill in the online form with all your patient details, so pretty much all the information that you needed to provide in the other form. It all has the APRI calculator here on the form that will happen automatically. So you'd fill in all your details and then you can just submit it. So it's pretty good, and you will hear back from them within 24 hours. So submit the form. And the good part about this is they will check back in with you 12 weeks post-treatment to find out the outcomes for your patient, to see whether they have been cured from the hepatitis C and whether they had managed to complete treatment. So that's a good reminder to follow up on your patient if you haven't seen them. Okay, so some more training and resources you can find on the ASHM website. They have a whole range of different resources and training for hepatitis C, and they're a really excellent source of information. So I've just put that in there for you. So some people may require a specialist referral for treatment and their GP or nurse practitioner may not be able to prescribe. So that's patients who have hepatitis B, HIV, cirrhosis of the liver, liver cancers, renal disease or pregnant. So these patients should be referred to a specialist via the Central Referral Service or to a private specialist for treatment. Some really good news, especially for people living in regional WA, is the telehealth exemption use. So since COVID, we have been using telehealth often to communicate with our GPs, but there was always sort of a ruling around that where you need to have been previously a patient of that GP and had seen them recently within 12-month period. If you're living with viral hepatitis, you can now access services from a GP without meeting that criteria. So that means, especially for hepatitis B, that's quite important because not all GPs can prescribe treatments for hepatitis B. You need to have further training, and not everybody does go ahead and have that further training. So this is actually excellent for people who may even not want to be treated in their community. Maybe they want to have some more confidentiality around testing and treatment for hepatitis, viral hepatitis. So this is the criteria. So all patients must have RNA confirmed. So PCR RNA confirmed, that means they have active virus in their blood. Patients 12 and over can be treated, but patients who are 18 and under need to be referred to a paediatrician for treatment. You can't be pregnant and you can't be breastfeeding while being treated, and you need to have a current Medicare to get the drugs under the PBS. There are no limits on the amount of treatment. So if people become reinfected, they can be treated again. So to reduce the number of times that you need to collect blood from a patient, it's really important to put this first dot point in. So when you're writing up the pathology request, if you put HCV antibody, and then if positive, add PCR, viral load, and genotyping. So that means if you send your patients bloods off, if they don't have an antibody, they won't do those further testing. But if they do find an antibody, they will go on to see whether there's actually active virus in the blood. It's really important because people who have cleared hepatitis C naturally, and 25% of people do, or if they've been treated and cured for hepatitis C, they will always have the antibodies show up in their blood, but that doesn't mean they have active virus. And if you got a patient's test results back and they had an antibody, if you needed to put further testing, you may need to draw blood again. So it's best to get it over and done with all in the one time. With the liver function test, remember we spoke about the APRI score, and for the APRI score you needed to have an AST, and it's not always automatically included in a liver function test. I've heard some pathology labs do, but not everybody. So just to be on the safe side, always include AST in your liver function test with a liver function test so you can get that APRI score. These are the rest of the bloods that you would request to work someone up for hepatitis C screening and treatment. What you could do is you could enter these in your pathology favourites in your patient management systems, or alternatively, you could copy and paste these onto a Word document and have it sitting on your computer, and then when you needed to fill in the blood tests, you could copy and paste into that. Because there could be quite a bit to remember. So the final blood tests are done 12 weeks after completing treatment, and this is to confirm whether a person has been cured or not. So just remember to do a recall in your patient management system for patients 12 weeks after they've completed the hepatitis C treatments. And these are a few of the barriers that people have said stop them from accessing treatment. So the belief that drug and alcohol consumption will make someone ineligible for treatment. For these new treatments, well, the new treatment since 2016, drug and alcohol use is not a reason to deny a person treatment. Many of the people who come through our needle and syringe program are currently injecting drug users and have successfully been treated and cured of hepatitis C. Some people believe the treatments are too expensive, and they were before they went on to the PBS, but at the moment they're their normal standard PBS rate. So I think that is now $42 if you don't have a healthcare card. So that would be per month, 3 months of treatment. If you do have a healthcare card, $6.80. If you're Aboriginal and Torres Strait Islander and you have a healthcare card, they're free. If you're Aboriginal or Torres Strait Islander and you don't have a healthcare card, $6.80 would be the cost per month. People still believe they have to go through the liver clinics for treatment. It's not necessarily so unless you have some of those comorbidities that were discussed before. There's quite a large stigma of bloodborne viruses, and that often can prevent a person from presenting for treatment. Hopefully, that's been reducing in our communities, and if a person would like, they can also access via telehealth a GP in a town or a city where they don't live if they want to, if stigma is a barrier for them. And also the hierarchy of needs. As we discussed, you might not be feeling symptoms for about 15 to 20 years, if at all. So people probably might put off having treatments if they have some other more important needs in their lives. You can contact us if you would like any support at all. We have a dedicated GP liaison nurse that can help GPs, nurse practitioners, nurses through regional WA with testing or treatment. And we also have some limited access to work with our nurse practitioner to get treated. So these are our telephone contacts, and there is our website. So thank you very much. I'm done.